Have you or anyone you know ever suffered from a migraine? All of us know someone 100% that has had a migraine before, or it may be us that suffer from migraine attacks. It can be deliberating. I mean, it affects your whole life, not just for a few hours, but even days and sometimes even months. It can affect your lifestyle, it can affect your work, it can affect your family, and so forth. This is exactly why I wanted to talk today and talk about what actually happens in your body during a migraine attack. I'm going to cover what is a migraine, what may be the triggers of a migraine, and what can happen in your body during a migraine attack. And then if you listen to the end, I'm going to give you 3 proactive, that's right, proactive tips to avoid a migraine attack. Let's get into it. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. I absolutely love, and appreciate your support. For any of you who don't know me, my name is Mihaela. I'm a qualified naturopath, absolutely passionate about all things health, business, and overall success. And today's segment, Mondays with Mihaela, is part of the Natural Health Podcast, which brings you simple, savvy, and sustainable health hacks to optimize your health. And to optimize your health, we need to know how we can avoid you getting a migraine attack. Because like I said, it hinders your health, it hinders your business, your lifestyle, everything. It affects your whole life if you get a migraine attack. They are extraordinary and can have such a huge impact, right? The interesting thing is that the Australian Bureau of Statistics does not hold statistics on the incidence of headaches, but it actually holds statistics for migraines, right? So in accordance to the ABS, for a period of 2007 to 2008, 5.7, which is 1.6 million Australians suffered from migraines. Of these, 3.3 were males and 8% were females. That is a lot of individuals suffering from migraines, right? Absolutely extraordinary, right? Migraine incidents were highest in the age group of 35 to 45 and followed by the age group of 25 to 34 and 45 to 54 age, right? So as we can see, it is the highest between 35 and 44 and then the second highest between 25 and 34. That is a lot of individuals who are affected by migraines here in Australia, right? So what is a migraine? Migraine is a common neurological disorder characterized by deliberating head pain with additional symptoms including nausea, vomiting, photophobia, noise intolerance, and occasional visual and sensory disturbance. Migraine is the most frequent headache, unfortunately, in children. It is a multifaceted condition which has so many different things taken into consideration, which I want to talk about later on. So essentially, there's 2 different types of migraines, and then underneath them, there's all different types of migraines. But there's 2 main ones, which is migraine without aura and migraine with aura. And then underneath them, there's other different migraines, but that's all I'm going to be talking about today, right? So migraine without aura, how is it diagnosed? You actually need to tick all these boxes, right? So I have at least 5 attacks that have the following: headache attacks lasting 4 to 72 hours. Headaches had at least 2 of the following characteristics: unilateral location, pulsating quality, moderate, severe, pain intensity, aggravation by or causing avoidance of routine physical activity, walking or climbing stairs. During headache, at least one of the following: nausea and or vomiting, photophobia, and phonophobia. And the other one is not attributing to another disorder. And then to be diagnosed with migraines with typical aura, you need to have at least 2 attacks that have the following: aura consisting of at least one of the following, but no motor weakness, fully reversible, visual symptoms including positive features, flickering lights, spots or lines, and or negative features, loss of vision, fully reversible sensory symptoms including positive features, pins and needles, and or negative features, numbness, fully reversible speech disturbance. Or at least 2 of the following fulfilling criteria: headache B and D for migraine without aura, beginning during the aura or follows aura within an hour. It does not fulfill criteria B and D for migraine without aura, begins during the aura or follows aura with 1 minute, 1 hour headache, does not occur during aura nor follows aura within 60 minutes, and does not contribute to another disorder. As we can see, there are criteria to me to go to a doctor for them to consider if you're suffering from migraines and which migraine you're suffering, so they know which pill to get you on, which pharmaceutical to get you on, right? So this is for you to get a bit of an understanding about migraines, right? So what are the triggers, right? Triggers are specific factors that may increase the risk of migraine attacks. Triggers do not cause migraines, right? They increase for you to have a migraine attack. They do not cause it, but are thought to activate the process in successful migraine sufferers. They recommend that patients keep a headache diary. Yes, this is key. If you do have migraines or headaches, please keep a diary. It's absolutely key, so you know what you did that day or the day before or the week before, so you know kind of what may have triggered it, right? So triggers are 12% of Caucasian population, predominantly female. Dietary triggers: skipping meals, fasting, sensitivity to specific foods, medication, overuse of pain medication or missed doses of usual medication, changes in sleep patterns, napping, oversleeping, or too little sleep, hormonal fluctuations, premenstrual, conceptive pill, perimenopause, ovulation, and so forth, right? Environmental. So the hormones is interesting why females might be more susceptible of having migraines than males due to the hormone fluctuation. Environmental: weather and temperature changes such as bright lights, odors, pollution, or factors such as air travel and high altitude. I remember I knew this individual that every time someone stepped into the room who had perfume on, this individual would straight away get a migraine, right? So this is environmental, okay? Stress: periods of high stress, accumulated stress, reacting easily to stress, suppressed emotions, and so forth. Anything that causes you stress. Even the interesting thing here is even weekends may cause you to have a migraine because you're actually reducing your stress. You're letting it go, right? Ending a stressful task and so forth, going on a holiday, yeah? So physical may be overexertion, injury, visual triggers, eye strain, bright lights, and so forth, becoming overtired and fatigued, right? So these are some of the things that may trigger your migraine. Maybe not be the cause of the migraine, which I'm going to talk about now. It may be the cause of triggering your migraine attack, right? So the reason why you've tuned into this episode is because you actually want to know what happens during a migraine attack. Okay. The way I'm going to answer this question is possible reasons why you may be getting a migraine attack, because it matters as to why you may be getting it, what is happening in your body. Okay. So although headaches and migraines are so common all around the world, not just here in Australia, the clear pathogenesis remains unclear. So what does that mean? We don't know what causes migraines and headaches. We actually don't know what actually happens in your body. There are many theories what may happen, okay? So vascular and neurological abnormalities have both been proposed as playing an important role in the pathogenesis of migraines, as have muscular tension and mitochondrial dysfunction, okay? Research supports the relationship between mitochondrial dysfunction and migraines. What's mitochondria? Mitochondria is the powerhouse in all of your cells. All of your cells have a mitochondria except your red blood cells. Crazy, right? So abnormal mitochondrial function leads to high intracellular concentration of calcium, excessive free radicals, danger, and deficient oxidative phosphorylation, which ultimately causes energy failure in neurons and astrocytes, thus triggering migraine mechanisms, including spreading impression, which is a little bit complex. I may go into another podcast when I talk about certain types of migraines, right? This is just an overview, okay? Mitochondrial abnormalities have been shown in migraine sufferers, including direct observation in a muscular biopsy of rag-red fibers, which are found in fibromyalgia sufferers, as well as other cellular abnormalities, right? So certain genetic mutations have been associated with migraine susceptibility, which we want to talk about soon. Also, abnormal serotonin metabolism has been implicated of pathogenesis of migraines. Serotonin causes blood vessels. Yes, we just want to talk about what serotonin does. But what I'm going to talk about now is I'm going to mention certain topics, and these topics may be what is causing your migraines and what is happening inside of your body during this migraine attack. Let's get into it. The number one is genetics. Okay, A genetic basis for headaches has been suggested as evidenced by several families and twin studies, right? So they observed a high concurrence rate for lifetime migraine among monozytic twins, then in diazonic twins, as well as for migraine headaches of the occurrence of disabling type. So they mentioned that the study of genetic effects of migraine headaches appeared to be stronger in females than males. So you may have to thank your migraines to your family, your mother and your father. Thank you for passing on that gene. Amazing, right? But as we know, genes, there's also genes make up 25%. What's the other 75%? Environment, epigenetics. All right. The other one is also platelet disorder, right? Abnormalities in normal function of platelets have been suggested to influence migraines. These abnormalities do not relate to increased number of size of platelets as they have been found to remain normal, but rather it is the composition of platelets of migraines appears to be unique. So it's not that what happens is that they increase in size, number or size, it's actually the abnormalities of the platelets, right? Is unique. So early studies undertaken in the 80s observed that platelets from migraine sufferers demonstrated high spontaneous platelet aggregation and platelet adhesion than platelets from controls during a headache-free period. Later on, it was observed that platelet aggregation occurred proportionally to the content of serotonin in the blood, and that migraine platelets may have problems retaining and holding serotonin. So this is what might be happening while you're having a migraine attack. You may not be able to retain and hold serotonin due to what is happening to your platelets. Okay, so that's one, is the platelet disorder. So we've got genetics with a platelet disorder, and the other one is serotonin abnormalities. So as I spoke about serotonin, I'm going to flow through it right now. So this is an interesting one, so bear with me, right? So the relationship between serotonin and migraine is so complex. Very complex. I could not even cover it probably in 6 hours talking to you about it, right? I don't even know it to a certain extent. But the exact mechanism that links abnormal serotonin mechanisms to headaches is still unknown. It is clear that serotonin plays a large role in the pathogenesis of migraines, as evidenced by studies on this topic, right? So considering that serotonin is involved in the regulation of pain, so low concentration of serotonin can be seen to contribute to considerable pain associated with migraines, right? So low serotonin, more pain, okay? Early studies show that serotonin was released by platelets during migraine attack, and that was initially proposed that hyposerotonin status was a causative effect of migraine tension headaches. So that means low serotonin, right? So they're saying that low serotonin may have been caused migraines. However, it now appears that low serotonin turnover and serotonin vascular hyperreactivity both appear to contribute to pathogenesis of migraine. So low and high. So what am I here always talking about? We need a balance. Right? Next one I want to talk about is vasomotor instability. So essentially, a vascular system has to play with migraines or us even getting a headache. Why is that? Okay, the changes in the blood vessels and cerebral vessel flow as a result of constriction, so less blood can go through, so making it smaller, or dilation, making it bigger of the blood vessels, have been found to be involved in pathogenesis of migraines. So that's what may be happening when you're having a migraine attack. Small, big of your vascular system causing your migraines, right? So what actually happens is animal studies revealed that stimulation of the brainstem nucleus, lotus cortellum, and raphidoralis alters both intrasenal and extrasenal blood flow, internal and external blood flow. They note that the cluster headaches vasodilation provokes a headache, so causes headaches when your blood vessels go bigger, whereas the constriction stops the headache, right? Thus promoting vasomotor stability. So maybe one of the helps too. So what they're saying is here, so make constricting the blood vessels maybe something to stop your headaches, migraines, right? Interesting, okay? The other one is neuroneural disorder sensory defects, right? Migraines have also been suggested to occur as a result of sensory defects in which the sensory system of the nervous system becomes hyperactive. So high, too much of it, right? In this model, platelet composition abnormalities and subsequent release of serotonin and other components during an attack are considered to be secondary events to sensory defects and neural disorders. So it's talking about serotonin again, it's talking about the blood system, it's talking about platelets, right? So this is what may be happening in your head when you are getting a migraine, in your body, not just your head. The other one, which is quite an interesting one, is medication reaction, right? Migraines may be associated with an adverse drug reaction to medication due to vasodilation or increased pressure. An example of this may be seen with the use of ACE inhibitors and calcium channel blockers, which may be used cause headaches due to their vasodilating effect. So medication that may be doing vasodilation may be causing you a headache or a migraine. Huge issue. Okay, so know what medication you're on. Medication may be causing you having a migraine. But also medication overuse, right? Overuse of medication leads to medication overuse issues, migraines, headaches, right? So this includes abuse of analgesic triptans and other acute headache medications, right? So this is an issue that we need to be aware of, is what are you taking? How much of it are you taking? Is it causing an issue, okay? The other one, why females are more likely to get migraines, is hormones, right? A large proportion of women who experience migraines report an association between menstrual cycle and their migraines. So migraines have been hypothesized to be influenced by fluctuating hormones level. So what may be happening in your body when you're getting a migraine attack? Your hormones may be fluctuating, right? Fluctuating, or you may have too much iron loss, so from your menstrual cycle, which has an effect on your whole body, on your hormones, and so forth, right? So this is why it's key to keep a diary, a headache, migraine diary. Absolutely key to keep one of those, right? The next one is what may be happening in your body when you're getting a migraine attack is that you may be having a food allergy or an intolerance. Migraines has actually been, it's interesting because, you know, we think about migraines, we think, oh, okay, cool, migraines. People get migraines. It's just a genetic thing. You know, your mom, your dad has a headache, a migraine, and so you're going to get it, right? But it's actually been called an allergic disease by some individuals, right? Because there's a proposed link between migraines and food allergies intolerances. So interesting, right? A high incidence of migraines and headaches have been found in patients with celiac compared with controls. However, adherence to a strict gluten-free diet was associated with a significant reduction in headaches, including migraines. Crazy. So many individuals also found favorable effects when they removed allergy or intolerance promoting items such as cow milk, wheat, chocolate, eggs, oranges, cheese, tomato, rye, rice, fish, grapes, onion, soy, pork, peanuts, alcohol, MSG, walnuts, beef, tea, coffee, nuts, goat's milk, and corn. These are the key ones that may be triggering your migraine, and that is what actually may be happening in your body. The other one is dietary amines, right? So these appear to trigger a migraine attack with a number of different dietary components, including the pathogenesis of migraines, including MSG, tyramine, phenylphenamine, nitrates and nitrates, alcohol, and caffeine. So it's kind of like important to keep a diary as to what you have been eating, what you have been doing, to see what may have triggered your headache and to understand what is actually happening in your body. So it's important to understand what's actually happening in your body. Why is this happening to us, right? So let's get to the most important part of this episode, which is what you've been waiting for. I know I've spoken a little bit of science, a little bit of confusing words which may not be making sense, but essentially what I was trying to say is that different things occur in your body depending on why you may be having a migraine and what has triggered your migraine. And these are the things that you need to discuss with your healthcare professional, who will look at you as an individual. Who will look at you as an individual, who will look at what is happening to you and what is happening to your body when you're having a migraine attack. Is it a serotonin issue? Is it a platelet issue? Is it a food issue? What is actually happening inside of your body? All right, let's get into 3 proactive tips to avoid a migraine attack. So interesting. I absolutely love it, right? Number one, that I always tell everyone, but especially individuals who have migraine issues, is hydration. Okay, dehydration is a huge trigger of migraine attacks. So optimal levels of hydration should be maintained. So there was a research study done where they got individuals to increase their water intake, and a reduction of migraines occurred immediately. One particularly interesting case is documented in which a participant who installed a reminder on his computer monitor with the message, "It's time to drink water," resulted in the individual increasing his water intake by 150% and led to a significant decrease in his migraine frequency, right? So is this something that you can do? Is this something that may be happening to you? Because you're dehydrated, your body's not functioning optimally the way it's supposed to be, everything's not working the way it's supposed to be, and you are triggering a migraine attack. Number 2 is sleep. I know I talk about sleep all the time. Sleep is so important. Sleep is key. But the important thing here to take note is, as we know, what triggers a migraine attack is stress, is things so forth. But a disordered circadian rhythm has been observed in individuals with migraines. So what does this mean? So individuals who have a disrupted circadian rhythm, who are awake at night and asleep in the morning, which is supposed to be the other way around, that may be making their migraines worse. They may have more triggers. They may have more frequency, right? So what needs to be done is they need to restore the circadian rhythm, restore their sleep, make sure that they're getting good quality of sleep. I don't care how many hours you're sleeping. I need to make sure that your quality is on point, right? Next one, number 3, I'm going to talk about supplements. I'm going to give you 2 supplements that are going to change your life if you have a migraine, right? The first one is vitamin B2, right? Vitamin B2 plays a key role in the cellular energy metabolism of mitochondria via its role in the enzyme system flavin mononucleotide. Because inadequate mitochondrial energy reserve has been suggested to be influencing factor of migraines, you can use B2 to correct this deficiency. So, as I spoke about earlier, you may be having a migraine attack due to mitochondrial dysfunction, right? Vitamin B2 has been absolutely amazing, has been shown in studies to assist with migraines, to reduce the frequency of migraine attacks. Vitamin B2 is absolutely amazing, right? But before doing any of this, please talk to your healthcare professional. This is information only. This is not advice. The next one is magnesium. Oh my gosh, magnesium is the best thing ever for anyone who has headaches, migraines, and so forth. Why, right? Magnesium plays an important role in the pathogenesis of migraine headaches, where it excretes numerous functions, all likely to influence the resolution of migraine attacks. So help you remove that migraine attack. Things that I've spoken about, right? So magnesium function as a vasodilator and relaxant, prevents spasm and altering neurotransmitter release and hyperregulation of platelets. Magnesium also influences serotonin receptors and inflammatory barriers that may be involved in a migraine attack, right? Deficiency of magnesium is very common in individuals who have migraines. So there you have it. How do you be proactive? There's so many more things to incorporate, but easy, simple, savvy first, right? Hydration, sleep, magnesium, and vitamin B2, right? These are the things that can assist you to reduce your migraine frequency. I hope that you now understand what a migraine is and what can be triggering your migraine attacks and what may be happening inside of your body when you are having a migraine attack, and then what you can do to reduce the frequency of your migraine attacks. Okay, because migraines can cause you so much hurt, so much damage. It can hurt your business, it can hurt the bottom line, it can hurt your family. Just days off that you don't really want to have days off. You want to be laying on the beach and relaxing. You don't want to have days off in a dark room because you're having a migraine attack. That is not what you want to be doing. I want you to live an optimal, healthy life where you are loving your life and you're living an optimal health. There you have it. If you know anyone who suffers from a migraine, please share this episode with them. Do what you do best. Love, like, share, rate, review, so everyone else is able to find this podcast easy like a click of fingers, so they can listen to the information that you have listened to today. Thank you so much. Do what you do best. Love, like, share. Until next Monday, love you.